This is Subi, lecturer from Immanuel Arasar College of Pharmacy. Today I am going to teaching about antacids. What are antacids? Antacids are weak bases that help reduce acidity in the stomach. How do they work? The stomach produces hydrochloric acid continuously in conditions like gastritis or peptic ulcer disease. Excess acid can cause pain, damage the stomach lining. That means ulceration. Antacids are weak bases. They neutralize excess gastric hydrochloric acid. They increase gastric pH above 4. Used in gastritis and peptic ulcer disease. Help relieve pain and prevent ulceration. Acid secretion is continuous, so antacids are taken repeatedly. The inactive pepsin, that means proteolytic enzyme, also used as home remedies for general stomach discomfort. Antacids do not reduce acid secretion, they only neutralize gastric acid. Antacids do not reduce the volume of gastric acid secreted but neutralize it and increase the gastric pH. Even after neutralization, proteolytic enzyme, that pepsin, activity is affected by pH changes. Another effect is that inactivation of the proteolytic enzyme pepsin due to increased pH. The stomach pH can range from pH 1 when empty to pH 7 when food is present. The low pH is due to the hydrochloric acid secreted in stomach when hyperacidity develops. It leads to gastritis, peptic ulcer disease. Peptic ulcers can occur in esophagus, stomach and duodenum. A peptic ulcer may be located in the esophagus, stomach and duodenum. Role of antacids. Antacids are used primarily for pain relief in acid-related disorders. They neutralize gastric acid, reducing irritation of the stomach lining. Higher doses given continuously can promote ulcer healing. In bleeding, peptic ulcer disease, antacids may be more effective than H2 receptor blockers in controlling symptoms. They provide rapid symptomatic relief compared to many other drugs. Antacids are used primarily for pain relief. In acid-related disorders, they neutralize gastric acid, reducing irritation of the stomach lining. Higher doses given continuously can promote ulcer healing. In bleeding of peptic ulcer disease, antacids may be more effective than H2 receptor blockers in controlling symptoms. They provide rapid symptomatic relief compared to many other drugs. Next, move on ideal properties of antacids. The antacid should not be absorbed or cause systemic alkalosis. The antacid should not produce laxative action or cause constipation. The antacid should exert its effect rapidly and over a long period of time. The antacid should probably inhibit pepsin. The antacid inhibit pepsin activity effectively. This should be palatable and inexpensive. The antacid should act as a buffer. It is maintaining pH 4 to 6. The antacid should not interfere with the absorption of food. It should not interfere with the absorption of food. The antacids should not liberate carbon dioxide when reacting with the gastric hydrochloric acid and should not cause rebound hyperacidity. The antacid should not liberate carbon dioxide when reacting with the gastric hydrochloric acid and should not cause rebound hyperacidity. The antacid should be stable and readily available. It is stable and easily available. The antacid should not cause side effect. Antacid should not produce side effect. The antacid should be insoluble in water and have fine particle form. Should be insoluble in water with the fine particles. It have better action. The antacid should exert its efficacy rapidly and over a long period of time. These are all the ideal properties of antacids. Next, move on. Side effect of antacid therapy. Side effect of antacid therapy. Acid rebound. When gastric pH becomes too high, the body responds by increasing acid secretion again. When gastric pH becomes too high, the body responds by increasing acid secretion again. Systemic alkalosis. Absorbable antacids may disturb body pH balance, causing alkalosis. Absorbable antacids may disturb body pH balance, causing alkalosis. Constipation or laxative effect. Aluminum and calcium salt constipation. Used to constipation. Magnesium salts having laxative effect. Aluminum and calcium salts having constipation effect. Magnesium salt having laxative effect. Increased blood sodium level. Sodium containing antacid can rise sodium levels, which is risky for patients on low sodium diet. Sodium containing antacids can rise sodium levels, which is risky for patients on low sodium diet. Example, hypertension, heart disease. Side effect of antacid therapy. Acid rebound. Next, move on. Classification of antacids. Classification of antacids. There are two types. Systemic antacid, that is absorbable, and non-systemic antacids. It is also known as non-absorbable. First, we can see about systemic antacids. These are absorbed into the bloodstream. These are absorbed into the blood. May cause systemic alkalosis. It may cause systemic alkalosis. Can worsen edema and heart failure due to sodium load. Can worsen edema and heart failure due to sodium load. Produce carbon dioxide leading to gastric distension and risk in ulcer. Example, sodium bicarbonate. Sodium bicarbonate is water soluble and potent neutralizer, but it is not suitable for the treatment of peptic ulcer because of risk of ulcer perforation due to production of carbon dioxide in the stomach. Next move on non-systemic antacid. They are insoluble and poorly absorbed systematically. They are insoluble and poorly absorbed systematically. Acting locally in the stomach. It is act as local effect. It's having local effect in the stomach. Do not cause systemic alkalosis. It is do not have systemic alkalosis. Safer for long-term users. It is safer for long-term users. This non-systemic antacid further divided into 4 groups. They are aluminum containing antacid, calcium containing antacid, magnesium containing antacid, and combination antacid preparations. Aluminum containing antacids classified again into 4 types. They are aluminum hydroxide gel, dried aluminum hydroxide gel, aluminum glycinate, basic aluminum carbonate. Then calcium containing antacid. Example, calcium carbonate, tribasic calcium phosphate. Magnesium containing antacids. Example, magnesium carbonate, magnesium hydroxide, milk of magnesia, magnesium trisilicate. Magnesium carbonate, magnesium hydroxide, milk of magnesia, and magnesium trisilicate. Combination antacid preparations. Magnesium hydroxide plus magnesium trisilicate, aluminum hydroxide plus magnesium hydroxide, cymeticone containing antacid, alginic acid containing antacid. Next, we have see about aluminum hydroxide gel. Synonyms: aluminum hydroxide mixture and aluminum hydroxide suspension. Aluminum hydroxide mixture and aluminum hydroxide suspension. Chemical information. Chemical information. Molecular formula Al2O3. Molecular weight 78. Molecular formula Al2O3 and molecular weight 78. Description. It is an aqueous suspension of hydrated aluminum oxide. It is an aqueous suspension of hydrated aluminum oxide. Contains small amount of basic aluminum carbonate and basic aluminum bicarbonate. Composition. Other name is additives. It may contain flavoring agent, peppermint oil and methyl oil. Peppermint oil and methyl oil. Sweetening agents, glycerin, sucrose and saccharin. Glycerin, sucrose and saccharin. Flavoring agent, peppermint oil and methyl oil. Sweetening agent, glycerin, sucrose and saccharin. Preservative up to 0.05% sodium benzoate. Strength. These contain 3.5 to 4.4. Strength. It contains 3.5% to 4.4% weight by weight of aluminum oxide. Next we move on. Properties of aluminum hydroxide. Appearance. White, light, amorphous powder. Odor and taste. It is odorless and tasteless. Solubility. It is soluble in dilute mineral acids and alkali hydroxide solution. It is insoluble in water. It is soluble in dilute mineral acids and alkali hydroxide solution. It is insoluble in water. Gel formation. Forms a gel on prolonged contact with water. pH range is 5.5 to 8. Adsorption property. Absorb acids and carbon dioxide. It is absorb acids and carbon dioxide. The aluminum hydroxide gel or ideal buffer in the pH 3 to 5 range due to its amphoteric nature. The aluminum hydroxide gels are ideal buffers in the pH 3 to 5 range due to its amphoteric nature. Preparation of aluminum hydroxide gel. Preparation of aluminum hydroxide gel. Dissolve sodium carbonate in hot water and filter. Dissolve sodium carbonate in hot water and filter. Add a clear solution of aluminum salt with constant stirring. Aluminum salt means like aluminum chloride or aluminum sulfate. Aluminum chloride or aluminum sulfate with constant stirring. Add more water and allow carbon dioxide gas to escape. Aluminum hydroxide precipitates. To give aluminum hydroxide precipitate. Collect the precipitate, wash it and suspend in purified water. And add peppermint oil 0.01%. It is act as a flavoring agent. Dissolve sodium carbonate in hot water and filter. Add a clear solution of aluminum salt with constant stirring. Add more water and allow carbon dioxide gas to escape to get aluminum hydroxide precipitate and collect it, wash it and suspend in purified water. Add peppermint oil 0.01%. It is act as a flavoring agent. And I also added sodium benzoate. It is act as preservative. 0.1% sodium benzoate we have added. It is act as a preservative. Chemical reaction. Aluminum sulfate plus sodium carbonate plus water to give sodium sulfate and aluminum hydroxide and evaporation of carbon dioxide. Key point. Aluminum hydroxide is obtained as a gel-like precipitate which is then suspended to form the antacid preparation. We get aluminum hydroxide in a gel form. Then it is suspended to water and to get antacid preparation. Uses of aluminum hydroxide. Widely used as an antacid in peptic ulcer disease, gastric hyperacidity. Non-absorbed antacid acts locally in the stomach and does not produce systemic effects. Neutralized gastric acid provides relief from acidity and pain. Buffering action. Maintains stomach pH in the range 3 to 5 due to its amphoteric nature. Productive effect. Forms a gel coating that helps protect the stomach lining. Forms a gel coating that helps protect the stomach lining. It is also used to skin protectant. Used as mild astringent, help to tighten tissues and reduce irritation. It is act as a skin protectant and mild astringent, helps tighten tissues and reduce irritation. Key point. Aluminum hydroxide is a multi-purpose agent mainly used as an antacid with additional topical protective actions. Aluminum hydroxide is a multi-purpose agent mainly used as an antacid with additional topical protective actions. Mechanism of aluminum hydroxide gel. Neutralization of gastric acid. Aluminum hydroxide reacts with hydrochloric acid in the stomach to form aluminum chloride and water, thereby reducing acidity. Aluminum hydroxide reacts with hydrochloric acid in the stomach and to form aluminum chloride and water, thereby reducing acidity. Reaction aluminum hydroxide plus hydrochloric acid to give aluminum chloride and water. Increase in gastric pH. Raise stomach pH to about 3 to 5, reducing irritation. Inactivation of pepsin. At a higher pH, the enzyme pepsin becomes less active, helping ulcer healing. At a higher pH, the enzyme pepsin becomes less active, helping ulcer healing. Protective coating forms a gel layer over gastric mucosa, protecting it from acid damage. It's form a gel layer over gastric mucosa. It is protecting from acid damage. Absorption action can absorb toxin, acids and gases, providing additional relief. It absorbs toxins, acids and gases, providing additional relief. Okay, today class is over. See you next class. Thank you.